Okay, today we're going to do a teach pack on nervous system disorders and musculoskeletal disorders. Okay, and as future nurses, you'll be handling a lot of patients which affects the brain and of course the musculoskeletal system. On the nervous system disorder, let's talk about strokes first, right? Okay, we said that another term for stroke is what? Cerebrovascular accident, which means it involves what organ?
Brain.
Cerebral means brain, vascular means what? Blood vessels, but which part of the blood vessel? Cerebral arteries. And of course, accident is not really an accident. It has to do with the fact that the pathology is in the brain involving the cerebral arteries, right? So when you say thrombotic stroke, what kind of clot is this? Stationary clot, okay? So you have a stationary clot, and where is this clot formed? In the cerebral arteries wall and lumen, okay? This is the artery of the brain. The clot is formed first initially as fat deposits will be forming here through atherosclerosis, and as the blood flow becomes lower, there's a greater tendency that the clot will form, the blood clot will form here, right? So if this is the brain, okay, spinal cord is here, the blood supply to the brain therefore will be affected because there's not adequate blood flow or absence of blood flow. You end up with decreased blood flow means ischemia to the brain, and whenever there is death of the brain cells, it's called what? Infarction. This way death is irreversible. Damage in the form of ischemia can still be reversed. Okay? Now, in the case of thrombotic strokes, the moment you have a blood clot here, what does it do to the blood flow? Obstructs the flow of blood. There is no blood flow. This part of the brain will what? Will die. Brain infarction. Okay? And as we said, the manifestations will be in the form of what? If the left side of the brain is affected, the right side gets paralyzed. Do you remember why? How can that be possible? Because you are absolutely right, the nerve fiber tracks. My left side of my brain controls the right side of my body. How? Think of the nerve fibers as telephone wires. These nerve fibers carry nerve impulses. The left side of the brain goes down on the left of the brain, then what? Cross to the opposite side. Where does it cross? In the medulla oblongata of the brain, the last part of the brain, and it goes to the other side. It starts to descend on the spinal cord on the right side. So what came from the left side will now be in the right side of the spinal cord. In other words, if you suffer a stroke on the left side of the brain, what gets paralyzed? Right side of the body. On the other hand, if you suffer a stroke on the right side of the brain, what gets paralyzed? On the left side, or what we call contralateral side, because contralateral means what? Opposite side, right? And you know the reason why there is an anatomical basis for these things to happen. Okay? Now, so that is called what? Hemi what? Plegia. And hemi means what? Half, half. Plegia means complete paralysis. What is hemiparesis? Okay, partial. So example, what do you think is this? Partial. See? What about if move the left side of your body? It's 0 grade or less than 0, it's what? Hemiplegia. Okay? Or there's no B muscle contraction. Right? Now, how is this different from TIA? In TIA, which means, what does TIA stand for? Transient ischemic attack. What do I mean by that? When the blood clot is here, it takes time for it to form, develop. So let's say it starts at 6 a.m. Okay? And then by the time it gets to block the flow of the blood, it's already what? Maybe 10 a.m. You would have what? Gradual onset of hemiparesis or plegia. But within 24 hours, what happens? The blood clot gets to be dissolved. Now, do you know that we have certain substances in our body that are thrombolytic substances, right? Or it gets dissolved and it's gone, and within 24 hours, what started as half of the body being paralyzed will be back to normal. Or half of the body becomes numbed, involving the sensory pathways, back to normal within 24 hours. That's the reason why it's called transient, because transient, is it permanent or temporary?
Temporary.
So within 24 hours, you have signs and symptoms similar to a thrombotic stroke, which is gradual, but apparently within 24 hours, back to normal. So these are the individuals who will be predisposed to the development of a thrombotic stroke. Now, how is it different from here? In a thrombotic stroke, because of the gradual formation of the clot within the lumen of the cerebral arteries, the weakness will also be what? Gradual. For example, you're married, you tell your wife, honey, as I was brushing my teeth at 10 p.m. tonight, I can notice there's some degree of weakness, right? Okay. And then you sleep, and then by 2 you went to the restroom. Instead of like this, it's now here. And then you wake up at 6 in the morning, like this, and then finally by 10 in the morning, like this. So what notice? It got worse, but it was gradual. Okay, gradual. It took time, so it's called gradual onset of weakness. Some would call it step ladder weakness. Weak gets weaker and weaker and weakest. Okay, and that's the reason why. How can you explain that? Because the formation of a clot with a pre-existing plaque of fat deposit there will also be gradual. On the other hand, when you say, so thrombotic is a stationary clot within the wall of the arteries of the brain. On the other hand, an embolus is what? A traveling what? Clot. And as we said, it starts where? The left side of the heart and the left atrium of the heart. And how does it get to the brain? Via what? The left common carotid, and then what? So the right, you have your brachiocephalic, subclavian, and the right common carotid. In the case of the left side of the aortic arch, the left common carotid comes directly from the aorta. So the common carotid is what you find in your neck, the arteries here. And then the common carotid divides into two, external and then what? Internal. External goes to the face, internal goes to the brain, which makes sense. Internal means inside. The moment it goes inside, it goes to the brain. It divides into the anterior cerebral, middle cerebral, posterior cerebral, and there's also a branch at the back called vertebral. So how is it possible for these to go to the brain? Very simple. If the clot is formed here, can it travel to the brain?
Yeah.
On the left side, by the left common carotid, which came directly from the aortic arch. On the right side, from the left side of the heart to the ascending aorta, aortic arch, right brachiocephalic or brachiocephalic, common carotid, internal carotid to the brain. And as we said, how is it possible to form a clot in the left side of the brain? We said what? Arrhythmias. A means without rhythm in the heart. Remember, the heart rhythm is what? Chig, jig, chig, jig, chig, jig. So when there is regular rhythm of the heart, chig, jig, chig, jig, there is continuous movement of what? Of the blood. Never a dull moment, the clot will never form because it's continuously moving. When I was a young boy, I was very observant. And when someone is trying to, prepare the chicken for the meal, when I can see the blood coming from the chicken and I put this blood inside a container, if I have 2 containers of blood, if one blood inside a container is being stirred with a stick and one container has blood that is not being moved at all, what happens to the blood inside that container that's not being moved by a stick? It coagulates, it clots. The same thing here. During the time when you have an erythema, and the most common is atrial fibrillation, AF. So instead of jig, 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 you have a skip beat. So there's a certain period of time when the heart is not pumping at all. So during this time, can you form a clot?
Yes.
Like the analogy I gave you. Yes, you can. Okay? So when you form a clot here, can that clot within 1 second, can it travel right away to the brain? So here, gradual onset of weakness if the clot is formed within the arteries of the brain. But here, the clot came from the left side of the heart. It travels to the brain. It is very sudden onset of what? Weakness. What kind of weakness? Hemiplegia or paresis. Okay? So obviously, if it is plegia, that means the obstruction to the lumen is complete. Does that make sense? Complete obstruction. Okay? So do you know the difference? So all these, the main problem is a blood clot, blood clot, blood clot. In a cardioembolic stroke, the clot came from where? The heart. That's why it's called cardioembolic. Embolus, traveling clot, it came from the heart due to an arrhythmia. Well, here, the clot really formed within the arteries of the brain. Is that clear? This will lead to this, but if it's within 24 hours back to normal, it's considered a TIA because the damage is reversible. And there's even no trace, but eventually, most of the time, this will become a thrombotic stroke. Okay? Now, hemorrhagic stroke. What happens in a hemorrhagic stroke? There's bleeding. What's the most common type of hemorrhagic stroke?
Bursted aneurysm.
Is an aneurysm more common than hypertension?
No.
Okay. So what's the most common therefore? A ruptured artery due to what? Severe hypertension. Can you imagine if your blood pressure is 200 over 100 or 190 over 100? Okay. Is that very high? Okay. So, when your blood pressure is very high and it's not being controlled because the patient is not regularly taking his medications for blood pressure lowering like antihypertensive drugs, and especially when they do this. Now look at me. Every morning you go where? The bathroom or toilet to make poo-poo, right? So when you do poo-poo and you're constipated, what happens? What did I do? Strain. We call that Valsalva maneuver. So when a person is constipated, will they strain? Yes, they will. And when they're strained, if the blood pressure is already high, can it even from 160 to 200, can it happen? It could, systolic. So what happens to the arteries in the brain? If this is the brain, they will burst or rupture. And there will be what? Bleeding inside the brain. Right? Do you understand, class? Okay. So there's bleeding inside now. That's one. So what's the most common? Hypertension. A ruptured artery to severe hypertension. So how do you prevent this? Lower the blood pressure, maintain the blood pressure by giving medications on time, low salt diet, low fat diet. What's the other one? You mentioned what?
Aneurysm.
Okay, an aneurysm in the cerebral arteries of the brain. So if this is the brain, what does that mean? The artery in the brain has a ballooning of the wall. It usually either is congenital, which means you were born with it, or you acquired because of severe hypertension. It could be acquired. Okay, it can also happen in the abdominal aorta, but it can also happen where? In the cerebral arteries. So there is an abnormal ballooning of the wall. The wall becomes weak as the blood pressure keeps on going up and going up, or when you strain, this balloon gets bigger and bigger, and when you strain, can that rupture? And can the blood go inside the brain and you have intracerebral bleeding? Yes, you can. What's the third one? AVM. What is AVM? Arterial veins or venous malformation. In Spanish, what does mal mean? Bad. Okay. Normally, if you recall your anatomy, an artery and a vein, what joins an artery and a vein? Oh my goodness, you're so smart. You're absolutely right. From high pressure, moderate pressure, low pressure. So from high, moderate, low pressure. So you need like a buffer zone. What happens if there is no capillary? Sudden change in pressure from high to low, that malformation can that burst or rupture? Very often. Okay? So what kind of weakness or hemiplegia would you expect to find on half of the body? Sudden or gradual? Sudden hemi what? Plegia or weakness. Why? Because the moment it ruptures, one half of the body gets paralyzed. I mean, my personal story, my dad, when I was a second-year resident in a big hospital for training, before he suffered a stroke, he had hypertension. So being a good son, I said, Dad, I do not want you to suffer a stroke. In our own dialect, I told him, high fiber diet to prevent what? Constipation, because you know what high fiber diet, right? Promotes peristalsis. And I said, in the event that you become constipated, what do? Take what? A laxative or a stool softener, right? And even told him what to go, where to go, because it's over the counter, what kind of drug, right? Or even a suppository. Now, guess what happened? And I told him, do not ever what? Strain when you're constipated. Do not strain. A month later, guess what he did? He strained. So at 6 in the morning, he was sitting on his throne, complete paralysis of the left side of the body. What part of the brain is affected? Right. The right. Okay? So he developed silent paralysis on one side, and I cannot forget my cousins and relatives were saying, oh, your father was so well behaved in the emergency room. He was practically snoring. And he didn't realize that he was already what? Stupor to coma, you know? Yeah. You know what I mean? Okay? So, among all the conditions here, which one is the worst prognosis for morbidity and mortality? And why? Okay? Of course, hemorrhagic strokes. Now, why would that be? What is the most important possible complication in a hemorrhagic stroke? Yes?
Medication.
What?
Pressure.
Okay, you understand the question? Most important complication of a hemorrhagic stroke. What could happen? And can that be life-threatening? Yes? Okay, there is increased intracranial pressure. Now remember, I want all of you to do this to your head. Go ahead. Okay, what is it? Hard or soft?
Hard.
Okay. Now you cannot open your brain. Is the brain soft? Yes, it is. The skull is hard to protect the brain inside, which is soft, right? Let's pretend this is the skull and this is the brain, right? Spinal cord, brain. What do you call the last part of the brain? Medulla Oblongata. Brain, medulla oblongata, spinal cord. Passes to the foramen magnum, right? The skull is hard, the brain is soft. So when there is bleeding inside the brain, will that blood occupy space?
Yes.
Of course. But the main problem is that the space inside is limited. The space is completely occupied by who? The brain. So the moment you have bleeding inside, and there's no way for the skull to expand because the sutures are fused, what happens to the intracranial pressure or the pressure inside the skull and the cranium? It goes up, which is just very simple physics, right? Without the capacity for the skull to expand, the pressure inside will be elevated. Now, where is the hole in the skull? The foramen magnum, right? The hole at the base of the skull. So the foramen is where the spinal cord will pass through, and this is the medulla oblongata. When the pressure builds up, what will the brain, what happens to the brain? The brain will what? Go up or go down? Down. Down. The pressure will push against the area of least resistance, which happens to be what? The hole at the base of the skull. So the brain will what? And what is a term used to describe when the brain descends into the foramen magnum as a result of increased intracranial pressure as a result of bleeding inside the brain? Herniation. Okay, what's the term? Herniation. What's the term? Herniation. It's called brain what? Herniation. Okay, herniation. Just like when you say herniated disc. What does it mean? That means the brain will descend into the foramen magnum, and guess what will happen? This is the foramen magnum at the base of the skull, like this. And if the brain will descend, what will the foramen magnum made of bone do to the medulla oblongata of the brain? Compress the medulla oblongata of the brain. Can anybody tell me what is the function of the medulla, the last part of the brain? Very good. Is the respiratory center. What do you mean by that? The breathing center. It controls respiration and breathing. So therefore, if you compress the medulla, you will what? Stop what? Breathing. And you will rest in 6 feet under the permanent resident of Forest Lawn Cemetery. So is it therefore imperative that we need to drain that blood so that the brain will not herniate. How do we do that? First, we do a scan, and after doing the scan, you know where the bleeding is. Can you do a craniotomy and remove the blood? Right? Okay, so you can do that. It's called a craniotomy. Does that make sense? Okay. Now, of course, some doctors may just rely on medical treatment, control the hypertension, control the bleeding, right? But the idea here is that it is very life-threatening if the brain, because the moment the brain herniates, can you push the brain upwards? No more. Okay? No more. So what is crucial here is time. Time is of the essence. The faster you do something to decrease the intracranial pressure, the better chances of recovery. Do you understand? Okay? Now, this is the big difference between all kinds of strokes. In the case of embolic strokes, the main consideration is that we need to treat the atrial fibrillation with anti-arrhythmic drugs. Of course, if you do not, then you keep on forming a clot, then you have a stroke every day. Can you imagine that? In other words, the doctor has to see to it that he is able to control the arrhythmia, or else he will have a stroke more common in the future. Okay, is that clear, class? Now, in the treatment of patients, and we'll just partially mention this because you are still in general education and you go to core nursing, you'll talk about pharmacology, but I just want you to know the importance of knowing the pathology of the disease. Because if you know what is causing the disease and the etiology or cause, then we'll know the treatment. Let's find out. TIA, blood clot. Thrombotic, stationary clot. Embolic, traveling clot. Can the patient be given a thrombolytic drug?
Yes.
Okay. What is thrombolytic? Lytic means dissolve, humus. Right? There are a lot of possible giving of this drug, right? ATPase, usually with ACE, ATPase. Okay? For the heart, we give receptor kinase, thrombolytic for the coronary arteries. But can we give a thrombolytic drug here?
No.
For hemorrhagic?
No.
Definitely not, because what will that do? Promote more bleeding. Understand? Can we give aspirin here?
Yes.
Yes, because it prevents what? Platelet aggregation. Right? Can we give aspirin here?
No.
No, and that happened to my dad. He was given aspirin. Did he get better? So I had to airlift him from the province. I live in a place called Dumaguete, a very small place. I had to bring him to Manila, a bigger place where I have a scan. There was no scan. This was 1988, a long time ago. Okay, and then lo and behold, full of blood because it was hemorrhagic stroke. Okay, now can I give anticoagulants here? Now remember, anticoagulants do not, I repeat, they do not what? Dissolve the clot. They're not lytic drugs. They can only what? Prevent further blood clot formation. So know the difference. Anticoagulants will prevent blood clot formation, future blood clot formation. Aspirin, also known as ASA. What is ASA? Acetyl salicylic acid, ASA, is actually aspirin. It prevents the platelet to what? Aggregate to form a plug. Remember when you have a blood vessel here and there is a wound, there's a what? The blood will come out, right? So the platelet will come together. Platelet fragments, remember the platelet is not even a cell, it's a fragment. They aggregate to form what? A plug to stop the bleeding. And that's how you form the clot too. Okay? Do you understand? Now, only where you have a clot you can give aspirin, thrombolytic drugs, anticoagulants. Here, never. It gets worse. But before we do anything, is there therefore a need to do a CT scan or MRI scan? Of course, because you want to know, is it a bleed or is it a clot that causes an area of the brain to have an infarction which can be discerned in a CT scan? We know the CT scan is better in an emergency situation. A CT scan, or what we call computerized tomography scan, will show you the slices in the brain that will give you a result within what? The machine will be ready within 1 or 2 minutes, CAT scan, you know where the problem is, what part of the brain is affected. Unfortunately, the MRI scan, it's a better detailed view of the brain, but unfortunately, it takes time for it to be ready. Like 1 hour to 1 hour 30. It takes time. I don't know with the newer versions now of the MRI scan. That's why in emergency rooms, you have what? CT scan much faster. Now, the following day, you might want to do an MRI scan the moment the patient is already stable. Do you understand? Okay? The idea here is that these are patients that requires immediate attention because what will kill them is a brain herniation. You understand? Okay? And because as a result of the increased intracranial pressure. Is that clear? Okay. Now, a lot of people get confused with the word traumatic brain injury. What is the cause of traumatic brain injury? Huh? Of course, don't you love pathophysiology? Trauma. How many of you here have been hit by a baseball bat to the head? Any volunteers? Okay? And we can actually see a live presentation of traumatic brain injury. If I hit you with a baseball bat, can it lead to a possible skull fracture? Okay. What about a patient who falls to the ground, hits his head on the pavement? Is that traumatic brain injury? What about a person who drives at 100 miles per hour, hits his head because the car is so fast? Is that traumatic brain injury? Okay. So trauma leading to brain injury. So is that the same thing as this? So do not ever think a stroke is due to trauma. No, because it's not stroke, it's rather called TBI or traumatic brain injury. Do you understand the difference? Okay. If you have heard about traumatic, you have coup, which means you hit here, and then contra coup means what? Because the deceleration and acceleration movements hit here, and then they're damaged on this side of the brain and that side of the brain, right? But essentially, just like in strokes, will there be edema and swelling of the brain?
Yes.
Of course, there will be cerebral edema and swelling. Will that also increase the intracranial pressure?
Yes.
And can that also lead to brain herniation?
Yes.
So time is of the essence. Now, in your study guide, I mentioned the word epidural versus subdural hematoma. If you remember, if this is the skull, the layer after the skull is what? Dura, then what? Arachnoid, then what? And that is on the surface of the brain. The pia is the innermost layer of the meninges, followed by the arachnoid, which is the middle layer. And what is the outermost layer? The dura mater. Dura means tough, mater means mother. Pia mater means what? Delicate mother. Okay. How many of you have tough mothers? Okay. How many of you have delicate or soft-spoken mothers? My mother was very delicate and soft-spoken, but sometimes it can be tough, especially I do not study my lessons. So I made sure I always wake up at 4 in the morning to study when I was 10 years old, right? Guess what happened? I got to be number 1 in the class, right? Because that is what my mother wanted me to be, right? To be the best that I can be, see? How many of you want to be number 1 in your class? You should, right? Don't compete with the others, compete with yourself, right? You don't care about those people. They will not pay your student loan, right? But you want to be the best that you can be, right? Okay. So wake up at 4 so that you can study for our quizzes and our tests, right? Now, when you have traumatic brain injury, therefore, you can either have, what is dura? Here. Epidural means above the dura. What is subdural? Below the dura. It's very common. A patient could fall. Now, I want to relate this story. This was a case of a cousin riding a motorcycle, and I hope you learned from this experience. And he fell from the motorcycle. He fell, sudden severe headache. It was in front of a hospital. He walked towards the hospital, like maybe 1,000 feet. He told the nurse, I have a severe headache. He started to have what we call projectile vomiting, headache, and then suddenly passed out. He became comatose. Okay? What do you think he suffered from? Epidural or subdural hematoma? What? Subdural. Okay. Okay. Why do you say subdural? Which is more dangerous, epidural or subdural? Subdural is wrong. It's okay. One mistake among friends, right? Okay. Still get a 90 out of, do you understand? Okay, why? In other words, of course, you already know the answer. Right? Epidural, a lot of you would think it's subdural because skull, dura. Epidural means above the dura. So for example, this is the dura mater. The skull is here, dura. Epidural, the hematoma or blood clot or formation of the blood will be here. The bleeding would be subdural, will be below. So you would think subdural is lower, nearer the brain, is more dangerous, right? That's not true. In fact, epidural is more dangerous or dangerous because why? Does anybody know why? What? Okay. Okay. Let us analyze. Let us dissect and analyze the answer, right? Before we open our mouths to answer, we must always what? 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 What is T-H-I-N-K? Think. Okay, let me think. I took anatomy, and I remember Dr. Gamo, which happens to be me, taught me that if there is bleeding, where is this bleeding coming from? A blood vessel. Because what is found inside the blood vessel? Blood. You're absolutely right. On the other hand, there are two types of blood vessels, arteries and veins. Both of them are blood vessels, therefore both of them contain what? Blood. Now, if you were paying attention to what I said a while ago, which one has a higher pressure? There's a reason why, remember in the blood flow discussion, pressure gradient, high, low pressure, the blood will flow from arteries to veins. And why is the pressure in the artery greater? For the main reason that the blood came from where? The left side of the heart, it was pumped to the aorta, then of course you have the arteries coming from the aorta. That means the blood pressure is much, much higher because it came from the heart. That's why remember, 120 over 80, what is 120? Systolic pressure, what is 80? Diastolic pressure. So, based on that knowledge that you have, it's called critical thinking. A nurse must be a critical thinker. A smart, critical thinking nurse is a competent nurse. Before he opens or she opens her mouth, she will always what? Think. Epidural is worse than subdural or worse. Why? What is involved in epidural hematoma formation? Arteries or veins? And what is the name of the artery in that area of the brain, in the meninges? What? Again, I will repeat the question. What do you call the arteries with that part of the meninges? Oh my God, you're so right, Bahe!
He gives.
Of course! It has to be what? Meningeal arteries, right? Don't you love anatomy, physiology, and pathophysiology? How many of you here love anatomy and physiology and pathophysiology? You should all raise your hand, right? Because this is your future. Passing the nursing board exam. Okay, now. Oh my God. What is the artery to the kidney? Renal artery, because what does renal mean? Oh my gosh.
Easy.
Artery to the stomach. Gastric, because what does gastric mean? What about the artery to the spleen? Splenic. Because what does splenic mean? Spleen. The artery to the liver. Hepatic artery, because what does hepatic mean? And therefore, what is the artery in the meninges? There you go. What about in the subdural hematoma? Meningeal what? Artery or vein? Veins. Okay. In other words, if you damage the arteries here above the dura, it's called epidural bleeding. The blood pressure is higher. It's like a fountain of blood. On the other hand, in the veins that are formed in the subdural hematoma, the bleeding will be what? Now, if you don't believe me, and you don't say, oh, Dr. Agamo, you're just pulling my leg, go home tonight, do an experiment, get a knife, palpate your radial pulse, that's the radial artery, get a knife, cut the artery, and then measure and take a selfie. Am I kidding? I'm very serious. It's called scientific investigation. I do not believe Dr. Gamo. I need to prove to myself that the artery has higher blood pressure compared to the vein. Now, if you don't want a knife, you can use a blade, a small blade for, get a small blade, and then feel the pulse. It's called radial artery pulse, right? There you go. Now, look for a nice vein. The vein, get a knife. If you don't like the knife, I'm scared of knives, Dr. Gamo. Here's a small blade. Okay. Cut, okay. Then measure the amount of blood and the time frame, which will make you die faster. What's wrong? Then you come back from heaven and give me a text. Dr. Gamo, I'm now in heaven. You are right. I tried both. I'm just joking, of course. It reminds me of this guy. He was involved in the Ponzi scheme, and he basically destroyed the financial empire in some people in certain places. I don't want to mention the name, okay? Anyway. So he decided to commit suicide, right? But unfortunately, he did not come to my class. He did not know the difference between an artery and a vein. So what did he do? He cut the vein, but after 1 hour, he said, what the heck, I'm still alive. Duh. You cut the wrong blood vessel. Another joke. How many of you were my former students in anatomy? Remember this joke? So this woman was so depressed. She found out that the husband was having an affair with another woman who was sexier and younger, So she got depressed. She went inside the bathroom, naked in the bathtub. She had a small blade, and because she did not take anatomy with me too, she decided to cut the vein. And the vein, the blood coming from the vein was, and it was so quiet in this bathroom. All she could hear was the blood. So she was saying, oh my God, I will now die. I will die because I just cut the vein. After 1 hour, she said, OMG, how come I'm still alive? And then suddenly, the husband came home, kicked the door, honey, what's wrong? And then, I'm sorry, honey, I will not do it again when you're still alive. I'm just kidding. And they live happily ever after. Okay. The moral lesson is, do not have an affair. And the better lesson is, do not cut your veins and arteries. It's not worth it, right? If your husband is having an affair, then get rid of the husband, get another husband who's richer and better, okay? Especially you are nurses, can you find a surgeon? The only problem with surgeons is that they can always change you every time they want to. I'm just joking, there are good surgeons, but there are also bad surgeons. They always want to find somebody who's younger and sexier, okay? That's a problem with men, I don't know why. Me, I only have one wife, that's my wife, okay? Honey, I love you. Now, okay, so, she would probably see this, she wouldn't even know I was on that. Okay, now, the bottom line is that when there is bleeding in subdural, it takes time. In fact, and this is a very common experience, when I was practicing medicine for 12 years in the Philippines, some of these people in the nursing home, they fall to the ground and nobody sees them. They're so embarrassed. And they stand and they sit in a wheelchair, and then they actually have subdural, but the bleeding was slow. So 6 months later, they suffered a stroke. You took a scan, there's a new bleeding here or a clot, but there's an old one, subdural, which did not kill them, right? But again, if it's epidural, remember my cousin? Fell from the motorcycle, is an epidural. Okay, is that clear? Okay. Now, so you see the difference between epidural and subdural hematoma, right? Now, in your list here, we talk about intracranial pressure, brain pressure. Now, what about the difference between? Talk about what exactly is the meaning of the word meningitis versus encephalitis? Meningitis means inflammation on infection of what? The meninges, dura arachnoid pia, right? So how would you know a patient has meningitis? Very common. High-grade fever. Second, alteration in the level of consciousness, right? So being awake, alert, oriented to time, place, and person, suddenly becomes what? Deterioration. It becomes drowsy and stuporous and comatose. And third, most importantly, a meningitis patient is called meningismus. They develop what? Stiff neck. Well, that's used by high school students. We don't say stiff neck. Of course, they might not know what is the term to be used, but we call that what? Nuchal, or what we call neck what? Rigidity. Which means that if this patient is lying down on the bed, if I move the head, the neck is so stiff, it can what? The entire body will move with the neck and the head. Neck rigidity, therefore, is seen when there is what? Meningitis. Okay, do you understand? And fourthly, what do they develop? Fever, headache, stiff neck, and sometimes vomiting. Projectile vomiting, which is an indication of swelling of the brain at the same meninges, and what is this? A seizure. Okay. Now, can that also be seen in encephalitis? Yes, it could be, but the manifestation of neck rigidity or NABNET is not a very common feature. Not very common. So what do? We do a lumbar tap. Why? Because when you do a lumbar tap, what level do we do the lumbar tap? Using the iliac crest. Let them lie down side lying. Do a fetal position. It opens up the vertebrae here. Why? Because the cerebrospinal fluid. Now remember the meninges. Remember the subarachnoid space is where you find the CSF, cerebrospinal fluid, right? Dura arachnoid pia. Subarachnoid means below the arachnoid. That is where you find the space containing the cerebrospinal fluid. That space is continuous with what? The spinal cord. Because in the spinal cord you also have the same layer, dura arachnoid pia, right here. We get fluid here. Why do we do it at L4, L5? Because we want to avoid damaging what? The spinal cord. So if you check the iliac crest here, L4, L5, because the spinal cord ends between L1 and L2. So is L4, L5 below L1, L2? Will that avoid damaging the spinal cord? All you need to do is get a specimen, we send it to the lab. Again, I do not want to, my wife is a microbiologist at Cedars-Sinai. What they do is do a culture and sensitivity testing of the CSF, trying to determine if there's bacterial infection or not. If the result shows after 1 day heavy growth of meningococcus or whatever organism is causing the infection, sensitive to ceftazidime, resistant to penicillin, am I going to give penicillin? No, because based on the results of the lab studies done, this organism is resistant to penicillin and it is sensitive to ceftazidime, then you better give what? Ceftazidime. Do you understand? Okay? And that's how we do treat patients. How do you know it's improving? Because the fever will what? Start to go down, seizures, you give anti-seizure medications, and then the patient will have improvement in their level of consciousness. Do you understand? Okay? So that's very important. And as I said, to differentiate one from the other and by doing a lumbar tap is very crucial. But oftentimes they also, before doing that, they also do what? A scan of the brain first, if possible. Okay? Because there could also be increased intracranial pressure. You have to watch out because there are possible complications of doing a lumbar tap. Okay? Now, what is the meaning of the word multiple sclerosis? What is multiple sclerosis? Another term for that is called demyelinating disease, right? If you remember, what is the role of the myelin? To this. MS, or what we call multiple sclerosis, affects what? The brain and spinal cord, CNS. When you say CNS, or central nervous system, what organs are involved there, class? Yes? Central nervous system involves what? Brain and what else? Spinal cord. Right? And therefore, if this were a neuron or nerve cell, dendrite, cell body, axon, some neurons of what? Myelin, right? This one has no myelin, the axon here has no myelin, the axon is what? So nerve impulse travels like this, right? The nerve impulse. Why is it faster in the presence of myelin? What does the nerve impulse do? So jump from one node of Ranvier, R-A-N-V-I-E-R node, to the next node. Which is, like for example, which is faster? If this were Dr. Gamo here, representing a nerve impulse, I will walk here without the myelin, I'll be walking this way. Like a model. On the other hand, if this is the myelin in the axon, I would be what? So which is faster, jumping or walking? Jumping. So pumping, right? In the presence of myelin. In MS, or multiple sclerosis, the damage is what? To the myelin in the brain and spinal cord, axons of the nerve cells or neurons. So without the myelin, what happens to the transmission of the nerve impulse or electrical impulses? Faster or slower? Slower. So can they manifest with motor weakness or paralysis? Yes. Can they have numbness and altered sensory components? Yes. Okay. The thing about MS, it usually affects women, girls between the ages of 20 to what? 50 years of age, like middle-aged women. And apparently, what is the mechanism involved here? Autoimmune. What do you mean by that? Auto means self, immune means these are women who got an infection. It could actually be the ordinary what? Flu virus or pneumonia, bacterial or viral. And these are what? What is an antigen? That's a foreign body. It's the enemy, right? Antigen. The bacteria causing the infection. What do women develop? Immune response. The antibodies form against the bacteria or virus. But what does this antibody and immune response do? Not only will it attack the enemy, which is the bacteria or the foreign organism, but it also attacks what? The myelin. That's why it's called demyelinating disease. Do you understand? There are periods of exacerbation and what? Remission, which means there are times when you have numbness and weakness, but there are times that you are what? Well. 1 month you're normal, the following month you're abnormal. You have all the signs and symptoms, and you get well. Signs or periods of exacerbation and remission when you're normal. What else? There are a lot of possible complications. One of the most common is what they call optic what? Neuritis, which makes you blind. Okay? Now, can we do a lumbar tap here? Yes, because the lumbar tap and the CSF findings, what would you be able to see in the cerebrospinal fluid? Antibodies. Which tells us that indeed it is what? Autoimmune. Okay? Can we do a scan, MRI scan of the brain? Yes, you can. And you can see lesions in the brain that affects white matter. Now, remember we say brain, white matter versus gray matter. Why is white matter white? What's the color of myelin? White. So that's why white matter contains myelinated axon, right? Okay. What is the term used to describe the presence of these lesions in the brain? It's called what? Plaque. Just like in atherosclerosis, plaque on the wall of the arteries, a fat deposit, is also known as a plaque. Do you understand? Now, what do we give these patients? Steroids. Why? What our steroid treatment can do? Immunosuppression. Remember, this is an autoimmune response. That means the immune response of the body got crazy. Instead of attacking only the enemy, the virus or bacteria, it decided to attack what? Your own myelin in the brain and spinal cord. So by giving a steroid preparation, steroids are what? Immunosuppressant drugs, which means that it will try and attempt to what? Suppress the immune response so that you can find a way to mitigate the problem. But unfortunately, it's not really a cure. And up to now, I think there's still no cure, right? Okay. Now, some people talk about plasmapheresis, which I don't have to go into detail. That means you get all the antibodies in the plasma, but still, the damage is already there. Okay? Do you understand last? Okay? Now, what about Parkinson's disease? Parkinson's disease involves what? There are two parts of the brain. One of them is the substantia nigra of the brain. Substantia nigra, N-I-G-R-A, substantia. That part of the brain is where you produce your dopamine, right? Dopamine. And this is going to be stored where? In the basal ganglia, which contains what? Remember the lessons in anatomy? Caudate nucleus, globus pallidus, right? And putamen. So this part called basal ganglia is also involved here. Now, if you remember in our lecture on nerve cells, this is the